Okay, so today we're going deep on behavior therapy.
Sounds good.
And we've got this really interesting set of notes here that I think we can really use to kind of break this whole concept down.
Yeah. Should be pretty interesting.
Yeah, I mean, it's all about really encouraging change in people, right?
Absolutely.
Yeah.
Yeah, and it's about giving people the tools to move away from kind of those unhelpful patterns that they might be stuck in
Right, exactly.
and move towards things that are actually going to get them to a better place.
Yeah, so for our listeners out there, I mean, especially if you are in the middle of your nursing studies, this is going to be absolutely essential stuff to know
Absolutely.
because you're going to be dealing with this all the time.
Yeah, this is going to be something that you can use day in and day out in your practice.
So what we want to do today is really dig into the core principles of behavior therapy,
Sounds good.
the real practical techniques that are used, and how nurses like you are really crucial to making these strategies actually work for patients.
Yeah, I mean, it all comes back to learning, right? How do we actually learn?
Exactly.
And how can we use that to kind of shape and modify behavior?
Yeah, so we're going to start by looking at some of the key learning theories
Yep.
that
Okay.
are really the foundation of all this work.
The underpinnings.
Yeah, exactly.
The bedrock.
Yeah, so we'll explore how we form associations, how consequences can really influence our actions, and even how powerful it is to just observe other people.
Yeah, I think what's fascinating is that these aren't just kind of like abstract theories. You know,
Yes.
they're not just sitting in a textbook somewhere.
Yeah.
They actually have really, really tangible applications
Right.
in healthcare every single day.
Yeah, for sure.
So have you ever kind of wondered how we can actually systematically help someone change a behavior
Right.
in a way that's going to stick?
Yeah, that's really the key, isn't it? It's
Yeah.
how can we make it actually last, not
Yeah.
just a temporary thing?
So let's get into it. Let's jump into the world of behavior therapy and see what it's all about.
Okay, so let's start unpacking this by looking at the theoretical foundations.
Okay.
And our notes point to three major learning theories that are like the pillars of this whole approach.
Yeah.
So first up, we've got classical conditioning.
Right.
And this was pioneered by Ivan Pavlov.
Yeah. Pavlov and his dogs.
Exactly.
Yeah.
It's a classic.
Yeah. So for people who maybe haven't heard of this before,
Yeah.
can you just give us the quick rundown of what classical conditioning is all about?
Yeah, sure. So at its heart, it's really just about learning through association.
Okay.
So think about Pavlov's dogs, right? They learn to connect the sound of that bell with getting food.
Right.
And eventually just hearing the bell alone made them start drooling
Wow.
because they were anticipating that food.
Right.
So it's really about how a neutral cue, something that didn't mean anything at first,
Yeah.
can become associated with a natural response.
Okay. So the bell didn't initially make the dogs drool,
Exactly.
but because it was paired with the food over and over again,
Yep.
it became this trigger. Yeah. It became a learned response.
Yeah, that's pretty amazing.
Yeah.
And our notes give a really good example that I think a lot of people can relate to. So imagine you get food poisoning from eating something specific.
Oh, yeah.
Later on, even just smelling that food can make you feel nauseous.
Oh, for sure. Yeah, I've been there.
Right. So in this case, the smell of the food, it didn't initially make you sick.
Right. It was the food itself.
Yeah, exactly.
Yeah.
But because it was paired with that awful experience of being sick,
Right.
now it's become a trigger.
It's that association.
Yeah, it's like your brain has made this connection.
Yep. Your body's learned to protect itself.
Wow, that's fascinating.
Yeah.
Okay, so that's classical conditioning.
All right.
What's next?
So next up, we have operant conditioning.
Okay.
This one was really developed by B.F. Skinner,
Right.
and it focuses on how the consequences of what we do shape our behavior in the future.
Okay, so it's not just about associations.
Not just association.
It's about what happens after we do something.
Exactly. So operant conditioning is really emphasizing that we learn based on what happens after an action.
Gotcha.
So behaviors that are followed by something good, by a positive outcome, we call reinforcement,
Uh-huh.
those are more likely to happen again.
Okay.
But behaviors that lead to something negative, or what we call punishment,
Right.
they're less likely to happen again.
Okay, so it's all about rewards and consequences.
Exactly.
Gotcha. So for example, if a patient is taking their medication regularly and they start feeling better,
Right.
that relief that they feel, that's a positive reinforcement.
Exactly. It reinforces that behavior of taking the medication.
Right. So they're more likely to keep doing it.
Exactly. Because it's leading to something good.
Yeah, that makes sense.
Yeah.
And then on the flip side, if a patient is told, you really need to follow this specific diet,
Mm-hmm.
but they don't,
Right.
and then their condition gets worse.
Right.
Well, that's a negative consequence.
Yeah, it's a form of punishment in a way. It's showing them that not following the rules can lead to something bad.
Exactly. So they're less likely to do it again.
Exactly. So it's really the outcome that kind of shapes whether that behavior is going to happen again.
Right. So the consequences are really key here.
Yeah.
Absolutely. Okay, cool. And then the third learning theory is social learning theory.
Right.
And this one is largely attributed to Albert Bandura.
Yep. Bandura really brought in this idea of how we learn by watching other people.
Okay, so it's not just about our own experiences.
Right. It's not all about us.
Yeah.
We're social creatures. We learn from each other.
Yeah, that's true.
So social learning theory is saying that we don't just learn from our own experiences,
Right.
but also from observing what other people do,
Okay.
what happens to them as a result,
Hmm.
and then we can decide, do I want to do that too or not?
So it's like learning by watching.
Yeah, exactly, learning by watching.
Uh-huh.
So think about a little kid, right?
Uh-huh.
They're always watching their parents,
Oh, yeah.
mimicking their actions.
Yep, they're like little sponges.
Yeah.
Exactly.
So they see mom or dad doing something, and then they try it out themselves.
Exactly, and they learn from that.
Yeah,
And in healthcare, this is really important.
right, because you could tell a patient, here's how you use this new device.
Right.
But if you actually show them...
Yeah, a demonstration is so much more powerful.
Right,
It's
exactly.
like watching a pro, right?
Exactly.
You can see exactly what they're doing.
Yeah, and they might be more likely to actually do it themselves if they've seen it done correctly.
Exactly. It gives them a model to follow.
Okay, so these three learning theories are really fascinating.
Yeah, yeah.
And they really provide like the groundwork for understanding all these practical techniques that are used in behavior therapy.
Absolutely.
So let's move on to those techniques.
Okay.
So how do we actually modify behavior?
Right. How do we put these theories into action?
Yeah, exactly. So the first one on our list is shaping.
Shaping.
Okay.
Mm.
So what is shaping all about?
So shaping is really useful when we're trying to get someone to do something that's kind of complex, something they can't just do perfectly right away.
Right.
So we kind of break it down into smaller steps,
Okay.
and we reinforce those little steps along the way.
Gotcha.
So each step gets them closer and closer to that bigger goal.
Okay, so it's about rewarding those little successes.
Exactly. Yeah, those small wins.
Okay.
So, think about teaching a child to speak.
Hmm.
Like at first, you might reward any kind of sound they make, even if it's just like a gurgle or a coo.
Right.
And then as they get better, you start rewarding sounds that are closer to actual words.
So you're kind of gradually shaping their speech.
Exactly, shaping their speech.
Okay, cool.
Yeah, so it's like, if you were sculpting something,
Mhm.
you start with a big block of clay,
Right,
and you gradually kind of chip away at it until you get the shape you want.
right. And each little chip is a step in the right direction.
Exactly.
Okay, so that's shaping.
All right.
The next one is modeling.
Modeling.
And we kind of touched on this earlier with social learning theory, right? It's all about learning by watching and then copying.
Right.
So if you can show someone how to do something,
Uh-huh.
that could be a really effective way for them to learn.
Yeah. It's like giving them a visual guide.
Exactly.
So like in nursing, if you're teaching a patient how to do deep breathing exercises,
Yeah.
you could just tell them, but it's much better to actually demonstrate it.
Show them exactly how it's done.
Right. So they can see the movements and how their chest should be rising and falling.
Yeah, it takes away some of the guesswork.
Right. Exactly. And it's really helpful when you're trying to teach a new skill.
Absolutely.
Okay. So that's modeling.
Right.
Then we've got the Premack principle.
The Premack principle.
Okay. This one is pretty interesting.
Yeah, it's kind of a clever little trick.
Yeah.
So
Yeah.
it basically says that you can use something that someone really likes to do
Mm-hmm.
to get them to do something that they maybe don't enjoy as much.
Okay. So like bribe them?
Well, not exactly bribe them, but kind of incentivize them. So, it's like that classic phrase, you can have dessert after you finish your vegetables.
Right.
So the thing they like, dessert, is contingent on doing the thing they might not like as much, the vegetables.
Right.
And our notes give the example of you can watch TV after you finish your homework.
Right.
So it's kind of tapping into that natural motivation,
Yeah.
using something they want to do
Mhm.
as a reward for doing something they need to do.
Yeah. That's a good strategy.
Yeah. And in healthcare, you could use this too.
Oh, okay. How?
So you could say something like, after we finish your physical therapy exercises, we can look at those magazines you brought.
Oh, right.
So you're using something they enjoy
Mm-hmm.
as a way to motivate them to do something that's important for their recovery.
Yeah. That's clever.
And what's really important here is that what someone finds rewarding is different for everybody.
Right.
So you really need to understand what your patient is interested in,
Right.
what motivates them.
Yeah, for sure.
Otherwise, this isn't going to work.
Yeah, that makes sense. Next we have extinction.
Extinction.
So that sounds pretty intense.
It's basically about stopping a behavior,
Okay.
but not by punishing it,
Right.
but by removing the reward that was keeping it going.
Okay, so like if a kid throws a tantrum to get attention,
Right.
and the parent ignores the tantrum,
Exactly.
the kid is not getting that attention anymore.
So the behavior is not being reinforced.
Right. So they're less likely to keep doing it.
Exactly.
Okay.
But there's something really important to remember here.
What's that?
It's called the extinction burst.
Extinction burst. What's that?
So when you first start ignoring the behavior, you might actually see it get worse for a little bit.
Oh, really?
Yeah, because the person is like, hey, what's going on?
Right.
I'm not getting what I want.
They're trying harder.
Exactly. They're trying harder to get that reward.
Wow. So you really have to be consistent with this technique.
You have to be super consistent.
Yeah.
Because if you give in during that extinction burst, it's actually going to make the behavior stronger.
Wow, that's good to know.
Yeah.
Okay. The next one is contingency contracting.
Contingency contracting.
So what is that about?
So this is a little more formal.
Okay.
It's basically a written agreement
Okay.
between two or more people,
Mm-hmm.
and it spells out exactly what behaviors are expected
Okay.
and what's going to happen if those behaviors do or don't occur.
So like rewards and consequences.
Exactly.
Right.
So our notes mention a patient signing a contract to attend a certain number of therapy sessions each month.
Right.
So the contract would say, you agree to come to this many sessions.
Okay.
And if you do, you might get certain rewards.
Okay.
And if you don't, there might be some consequences.
Right. So it's very clearly laid out.
It's all spelled out,
Right.
black and white.
Okay.
And this can be really helpful when it's super important for someone to stick to a plan.
Right.
Like if they need to go to therapy regularly or take their medication every day.
Yeah, that makes sense. Then we have token economy.
Token economy.
So what's that all about?
So this is like a system of rewards.
Okay.
But instead of getting actual rewards right away,
Uh-huh.
you get tokens.
Tokens.
Yeah, like points or stars or chips.
Right.
And then you can save up those tokens
Okay.
and exchange them for something you want.
Oh, that's cool.
Yeah. So our notes give the example of a group therapy setting
Uh-huh.
where patients can earn points for participating.
Okay.
And then they can use those points to get things like extra phone time
Oh, that's a good one.
or maybe access to some fun activities.
Right. So it's like a way to motivate people to engage in positive behaviors.
Exactly. And those tokens, they act as like little mini rewards.
Right.
So it's kind of like immediate gratification,
Right.
which can be really motivating.
Yeah, I can see that.
Okay.
Okay. Next up is timeout.
Time out.
And this is one that I think a lot of people are familiar with.
Yeah, especially if you have kids
Right.
or if you were a kid.
Exactly.
So timeout is basically about removing someone from a situation
Uh-huh.
where they're getting some kind of reward or attention for a behavior you don't want.
Right. So like if a kid is acting up,
Right.
you might send them to their room
Exactly.
where they can't get that attention anymore.
Right. So the idea is that their room is less stimulating.
Right.
It's not as fun as being with everyone else.
So they're less likely to keep misbehaving.
Exactly, because they're not getting that reward.
Right.
And the key here is that the timeout spot has to be boring.
Right.
It can't be like, oh, this is a fun little break.
Right.
It has to be like, okay, this is not where I want to be.
Right.
I'd rather be back with everyone else.
Exactly.
Okay.
Then we have reciprocal inhibition.
Reciprocal inhibition.
So what is that all about?
So this one is based on the idea that you can't really do two opposite things at the same time.
Okay.
So if you're trying to get rid of a behavior,
Uh-huh.
you can try to introduce another behavior
Okay.
that's incompatible with it.
Okay. I think I see where you're going with this.
Yeah, so like let's say someone has a lot of anxiety.
Uh-huh.
Well, feeling anxious and feeling relaxed, those are pretty much opposite.
Right.
So if you can teach them relaxation techniques,
Uh-huh.
they can use those techniques when they start feeling anxious.
And the relaxation will kind of override the anxiety.
Exactly. They can't really be anxious and relaxed at the same time.
Right. So it's about replacing the unwanted behavior with something that's incompatible.
Exactly. Yeah. And that can help to reduce or even eliminate the problem behavior.
Okay. That's a cool technique.
Yeah.
All right. So now we're moving into some techniques that involve like using unpleasant consequences to
Right.
discourage behaviors.
Okay.
So the first one is overt sensitization.
Overt sensitization.
So what does that involve?
So this one is about using something unpleasant that the person actually experiences
Uh-huh.
to make them less likely to do the unwanted behavior.
Okay.
So our notes mention Antabuse.
and abuse.
Yeah, it's also known as disulfiram, and it's used to help people who are trying to stop drinking alcohol.
Okay.
So if someone takes antabuse and then drinks alcohol,
Uh-huh.
they get really sick.
Oh, wow.
Yeah, nausea, vomiting, all that fun stuff.
So it makes drinking alcohol a really unpleasant experience.
Exactly, and the hope is that they'll start associating alcohol with those negative feelings.
Right, and be less likely to drink it.
Exactly. So it's
Yeah.
about creating that negative association.
Gotcha. Okay.
Then we have covert sensitization.
Covert sensitization.
And this one sounds like it takes place more in the mind.
It does. It's all about using imagination.
Okay.
So instead of actually experiencing something unpleasant,
Right.
you imagine it.
Okay.
So like our notes say, if someone wants to quit smoking,
Uh-huh.
they could imagine themselves getting really sick every time they think about lighting up.
Oh, wow.
Yeah. So they might imagine coughing uncontrollably or having trouble breathing.
So it's like mentally linking smoking with those negative consequences.
So.
Exactly. And the hope is that it'll make them less likely to want to smoke.
Okay, that's interesting.
Yeah, it's all about the power of the mind.
Yeah, for sure.
Right.
Okay, so next up is systematic desensitization.
Systematic desensitization.
This one sounds a little more gentle.
Yeah, it's a much more gradual approach.
Okay.
And it's often used for things like phobias and anxiety disorders.
Okay.
So basically, you gradually expose someone to what they're afraid of,
Uh-huh.
but you do it in a really controlled way.
Okay.
And at the same time, they're learning relaxation techniques.
Okay, so like for someone with a fear of heights,
Right.
they might start by just looking at pictures of tall buildings.
Exactly, and practicing deep breathing.
Okay.
And then maybe they move on to looking out a low window,
Okay.
still using those relaxation techniques.
Right.
And then gradually they can work their way up to higher and higher places,
Okay.
always pairing the exposure with relaxation.
So they're slowly getting used to it.
Exactly. It's like slowly desensitizing them to their fear.
Okay.
And then finally, we have flooding,
Flooding.
also known as implosive therapy.
All right.
This one sounds pretty intense.
It's basically the opposite of systematic desensitization.
Oh, okay.
So instead of gradual exposure,
Right.
you're thrown right into the deep end.
Wow.
So like if someone has a fear of elevators,
Uh-huh.
they might be made to ride an elevator over and over again
Wow.
until they calm down.
That sounds pretty scary.
It can be, and that's why it's really important to note that this is not for everyone.
Right.
It has to be done really carefully by
Yeah.
a trained therapist,
Right.
and the person has to be fully on board with it
Exactly.
because it can be overwhelming.
Yeah, for sure.
But for some people, it can be really effective.
Okay, so I've got this whole spectrum of techniques.
Yeah, whole toolbox.
Yeah, from really gentle to very intense.
Exactly.
So now let's talk about the role of the nurse in all of this.
Right, because nurses are key.
They're essential.
Absolutely.
So where do nurses fit into behavior therapy? Well, it starts with assessment.
Okay.
Nurses are often the ones who are with patients the most.
Right.
So they're in a perfect position to really observe their behavior
Yeah.
and notice any patterns that might be a problem.
Right. So they're like the eyes and ears on the ground.
Exactly.
Okay.
And it's not just about noticing the behavior itself.
Right.
It's about figuring out what's triggering it.
Right. What comes before it
Exactly.
and what might be reinforcing it.
Yeah, what's keeping it going.
Right.
So really understanding the function of the behavior.
Okay.
Why is the patient doing this?
Yeah.
What are they getting out of it? Or
Yeah.
what are they avoiding?
Because if you don't know that,
Yeah,
you can't really address it effectively.
exactly. You're just shooting in the dark.
Right.
You need to understand the root of the problem.
Okay. So that's assessment.
No.
And then once you've done that assessment, what's next?
Then it's time for goal setting.
Goal setting.
Yeah.
So what does that involve?
So the nurse works with the patient,
Uh-huh.
their family, and the rest of the healthcare team
Right.
to come up with some really specific goals
Okay.
for behavior change.
Okay.
And these goals, they need to be realistic.
Right.
They need to be achievable.
Uh-huh.
And they need to be something that the patient is actually on board with.
Right, because if the patient doesn't care about the goal,
Exactly.
it's not going to work.
It's not going to stick.
Right.
So, instead of a vague goal like the patient will feel less anxious,
Uh-huh.
you might say something like, the patient will be able to use 3 new coping mechanisms for anxiety by the end of the week.
Right. So much more specific
Much more specific
and measurable.
and measurable.
Okay.
So you can actually track progress
Right.
and see if the interventions are working.
Okay, so that's goal setting.
All right.
And then once you've got the goals,
Then it's time to put those behavior modification techniques into action.
right, implementation.
Implementation.
So how are nurses involved in this?
Well, nurses are the ones who are going to be using those techniques day in and day out.
Right.
So they might, use positive reinforcement
Mm-hmm.
to encourage good behaviors.
Okay.
They might act as role models
Right.
by showing patients how to do things,
Okay.
like healthy coping strategies or self-care techniques.
Right.
They might even guide patients through some of the techniques we talked about earlier,
Okay.
like relaxation exercises, or maybe even the early stages of systematic desensitization,
Right.
obviously under the supervision of a therapist.
Of course.
But the key here is consistency.
Consistency.
Everyone on the healthcare team needs to be on the same page.
Right.
Because if one nurse is doing one thing and another nurse is doing something else,
Right.
it's going to confuse the patient
Yeah, that makes sense.
and it's not going to be effective.
Right. So everyone needs to be following the same plan.
Exactly. A unified approach.
Okay.
Oh.
Okay. And then what about patient and family education?
Right, because this is huge.
Yeah.
Nurses are really important for this.
Okay, so what do they do?
Well, they teach patients and their families about the behavior modification techniques.
Mm-hmm.
They explain why they're being used,
Okay, yeah.
how they work,
Right.
and how everyone can participate.
Okay, so they're really empowering the patient and the family.
Exactly. Giving them the tools to continue the work outside of the healthcare setting.
Right, because it's not just about what happens in the hospital.
It's about making lasting changes.
Exactly.
Okay.
And then finally, we have evaluation.
Evaluation.
So how do nurses contribute to this?
So nurses are constantly observing their patients,
Okay.
taking notes on their behavior,
Uh-huh.
and tracking their progress towards those goals.
Okay.
And this helps them to see if the interventions are working,
Right.
if they need to be adjusted.
Okay.
And it also allows them to share their observations with the rest of the team.
Right, so it's a constant feedback loop.
Exactly.
Assess, set goals, implement, evaluate.
And then reassess and adjust as needed.
Right, so it's a dynamic process.
Yeah.
Wow. So nurses really are essential to making behavior therapy work.
They really are. They're the
Yeah.
glue that holds it all together.
Yeah, they're the ones who are there with the patients day after day.
Exactly. And they have those strong relationships with the
Yeah.
patients, which
Yeah.
is so important.
Yeah, for sure.
Okay.
So how does all of this connect to like broader nursing practice?
Right. Because this isn't just about formal behavior therapy programs.
Right.
This stuff applies to so many different areas of nursing.
Okay.
So, if you understand how behavior works,
Uh-huh.
how it's learned, and how it can be changed,
Right.
you can use that knowledge to help patients in so many different ways.
Okay, give me some examples.
Sure. So, maybe you have a patient who's having trouble sticking to a complicated medication schedule.
Mm-hmm.
Well, you can use positive reinforcement to encourage them.
Right.
Or maybe you need to teach a patient how to give themselves an injection.
Okay.
You can use modeling to show them exactly how it's done.
Right.
And in mental health, nurses can work with therapists to help patients manage their anxiety
Okay.
using things like systematic desensitization.
Right.
So the possibilities are really endless.
Wow. So these principles can be applied in so many different ways.
They really can.
That's amazing.
It's about having a deep understanding of behavior
Right.
and using that understanding to help patients.
Yeah, that's really powerful.
Okay.
All right, so we've covered a lot of ground today.
We have.
Let's just quickly recap the key takeaways.
Okay.
So behavior therapy is a structured approach
Right.
based on all these learning theories.
Yeah.
And it focuses on using reinforcement and conditioning to help people change their behavior.
Exactly.
And we've talked about all these different techniques.
A whole range.
Yeah, from shaping and modeling to flooding.
Right.
And we've highlighted how important nurses are in this whole process.
Absolutely. They're essential.
Yeah, from assessment to implementation to education and evaluation.
Yeah, they're involved in every step.
Yeah.
And I think it's important to remember that all of these techniques, they're all rooted in how we learn,
Right.
how we form associations,
Uh-huh.
how our experiences shape our behavior,
Right.
and how we learn by watching other people.
Yeah, so understanding those fundamental principles is really key.
Absolutely. It's the foundation.
Okay, so for all of you nursing students out there,
Yeah.
as you continue your studies and eventually start working with patients,
Right.
think about how you can use these techniques
Yeah.
to help people achieve their goal.
Exactly, because this is really powerful stuff.
Yeah, it's amazing how much you can accomplish
It is.
when you understand behavior.
And we encourage you to, kind.